We're live now.
Okay, hello everyone, welcome back. Happy afternoon. Thank you for coming again to Fresh Dental Shadowing. Today we have the wonderful Dr. Gupta, who's a restorative and cosmetic dentist. So he's going to be sharing a little bit about that. So you can go right ahead whenever you're ready.
All right. Good afternoon, everyone. And in some places it might be morning, but happy to be here. Thank you so much, Helen, Iris, and Mahira to invite me on the Fresh Dental Shadowing. I'll be really happy to share whatever I know. And any point of time, if you have any question, feel free to ask. Don't worry, you won't be interrupting my flow. So to begin with, I'm a DDS, MPH, and BDS. Most of you might not know what BDS is. BDS means like Bachelor in Dental Surgery. So I'm a foreign trained dentist from India. And I graduated in 2011. I came to United States, finished my MPH. And during that time, I applied for dental program. It's a bit different process compared to regular or traditional DDS program. Like instead of 4 years, I just have to do 2 years because of already have a background in dentistry. And so that's a bit different about being a foreign trained dentist. Some things might not correlate. Like sometimes you guys have to give ADAT exams and all that. You have to go NBD Part 1 and Part 2 throughout your dental program. In our case, we have to clear those exams before we apply to dental school. So today's presentation, I'll be covering a little bit of introduction about me, couple of cases, how I approach, how I treatment plan, some advice, and obviously question and answer. So, and before we start, like all the pictures I have in the presentation, it's taken by me, and no copyrights or anything. So usually I take all the pictures, and if you have any question about photography, I'll be happy to share that as well. So as I briefly mentioned, I'm from India. I'm currently living in Irvine. I just talking to Iris that come to know you guys from UCI. It was really shocking to me. Like I was thinking different part of the country. So I did my BDS from KD Dental College in India, graduated in 2011. I was preparing for residency in India. We call postgraduate examination. While that, I applied for MPH program, and I got accepted at University of North Texas Health Science Center. And it's a bit of a funny story that I finished my program MPH on Friday, and on Monday, my orientation at USC in California. So I drove from Texas on Saturday morning, and I reached Sunday afternoon to attend the orientation on USC. And it was like really horrible drive, and I would never recommend to drive alone with so much stuff in your car. So it was a bit adventure, but I'll never do that again. So I did MPH in biostatistics. It's mostly about analysis and data analysis, and it helps you with the research to reach a conclusion in that way. So in 2017, I graduated with DDS. So from 2015 to 2017, I was at USC Southern California. It's a beautiful program they have at USC, focusing a lot on CAD/CAM dentistry, current concepts, adhesive dentistry, biomimetic dentistry, a lot of like big names. Stanley Malamero used to be faculty at USC. Pascal Manier, if you know what biomimetic dentistry, we have recently had books came out, and it's a beautiful book. Along with that, DDS, I'm a member of AGD, I'm a member of AACD, and I'm preparing for fellowship with AGD and accreditation with AACD as well. And AACD is like American Academy of Cosmetic Dentistry, and it have a lot of content. People are really open. So if you're part of that, if you're really interested in cosmetic dentistry, you should really be a member of that. So moving forward, about me. So I'm a general dentist. I feel like general dentist is kind of like a Swiss knife. What it means, we're able to do everything. You can do endo, you can do perio, you do OS, you can place implants, you can restore implants, you can do anything you want. It's just that you need to have the skill set to do that. And that's what I like, because sometimes I get bored doing the same thing again and again. And that's why being general dentist helps you. Just full disclosure, my favorite procedure is always root canal. It's just like sit down, find the canals. For me, it's like a meditation. by end of the day, if I have a root canal, I'm like happiest person on the planet. Like sit down, enjoy the root canal, and go home. Most of my assistants don't like it. A lot of dentists don't like it. I enjoy it. Other than that, if I have to choose specialty, I would choose OS or perio. Like second favorite procedure would be anything related to surgery, anything messy or bloody. I would say that. I never applied to residency so far. I'm still looking into it. I haven't decided yet, but I'm enjoying general dentistry so far. So again, I briefly mentioned about I'm a foreign trained dentist. So if anybody wants to know the process, it's a bit of a process different from the traditional TS program. And most of the schools, they have program from 2 to 3 years. And it's kind of like what traditional program they have to finish in 4 years. We have to finish everything in 2 or 3 years, depending on the length of the program. And it's really condensed, good exposure. I feel like it's kind of refinement of skills what you already learn in your country, and to understand how dentistry works in this country. And to my opinion, it's totally different, but it's also amazing how you can do dentistry over here. And a bit of experience, like if you are a foreign trained dentist and you practice dentistry over here, you get a best of both worlds. Like in India, we have a lot hands-on experience, like in terms of extractions. Like we had to graduate with 200 extractions. We had to do at least 10 complete dentures and I think 20 removable partial dentures, if I'm not wrong. And it gives a lot of hands-on, and we work in the lab, so we make a lot of things from scratch. So it helps you understand the lab portion of it along with the clinical chairside portion of it too. So I know when I at USC, I think we had to do 50 extraction. I know it's good amount, but more the merrier. As much exposure you can get, that's always help you to be a better clinician. So again, some photography. I always love to do my restorations and cases. So I'm sorry. So where do I practice? I practice currently in Hawthorne, California. If you're in UCI, you know it's a heck of a drive from Costa Mesa to Hawthorne, and it's okay. Practice our work. It's a corporate practice, corporate setting, and some people refrain to work in a corporate setting, but try to look at the brighter side. They know the business. Dentistry is always easy. You take a bunch of CEs, you understand. In endo, you take a 1 weekend CE course, you understand how to do endo, and then you get better and better. But to understand business, you have to work in a certain area. They know the business better. And that's why I feel like dentistry is easy, business is not, and it takes time to understand the business. And I graduated in May 2017. It's going to be 5 years in May. And this is the third corporate setting I'll be working in. And every corporate setting works differently. They all have some pros and cons. And you have to look at it, what works in favor of you. One thing I always look at it, you should be able to learn something. It's not necessarily you learn it clinically, even if you learn something business side, or if it helps you improve your interpersonal skills, if it helps you to submit better claims to insurance, or to work on your skill, like be time efficient, help you increase speed or quality, anything it helps you, I think it's a good fit. I understand pay and sanity is also a big thing, but you have to look at long run. Like, okay, most of the dentists wants to own their own practice, and nowadays it's people have their own practice before they graduate, so it's not an impossible thing. You just have to plan it ahead and implement it. So my couple of my deciding factors are the current practice that I'm working. I'm doing a lot of implant cases, high-end dentistry, cosmetic cases. I get to have my own time to work on, like, document most of my cases. I take a lot of pictures, so it helps me improve my photography skills and implant restorations, implant placement, other high-end procedures. It helps me to work on my skill set. So these are the case I delivered. I think top and bottom 6, actually top 6 and bottom 6 veneers, and I was like, want to take a beautiful picture. It blend in so nicely with the tissue. So this is another picture I take with the patient. And I'm missing. Yes. So 2 things I won't and I will not practice dentistry with first my loops. And someone said that to me, like, without loops you cannot see. And I feel like if you don't know it, you cannot see it. If you cannot see it, you cannot diagnose it. If you cannot diagnose, you cannot treat it. And you need a better magnification and illumination to see teeth. Like if you look at dentistry, it's just not dentistry, it's micro dentistry. Other than endodontists, cosmetic dentists are using microscopes. We're using camera, DSLRs with macro lens to take pictures, and you can zoom in up to such a detail level. As you can see in my previous picture, you can zoom in a so detail. You can see a tiny speck. If there's a remnant of like 0.5 millimeter of cement you left it, you can see in that picture. So invest in a good loops. It's always help you to deliver quality care. According to me, it should be a standard of care. Like your dentist should use loops. And the magnification. Then a funny story about like why I chose when I was in dental school at USC. In India, we did not use loops. When I was at USC, one of my faculty would show like, okay, there's a 0.65 millimeter bevel, and I couldn't see it. Like every time I say, okay, you're missing it. It's not 0.65 millimeter bevel, and I'm not able to see it. And I was like mad at it because I couldn't see it. So I asked him like, what magnification loops do you use? They're like 4.5. But yeah, I'm gonna get 4.5. So I got 4.5 magnification loops back in school, and 2 years ago, one of the IPs came out, and I sent it to the surgical to get it fixed, and unfortunately, USPS lost it, and couldn't get it back. So I asked the rep, okay, if I get 4.5, what's the pricing? It's like just a $200 difference if you go 6.5. Might as well just go for 6.5. And like, I'm a 6.5. My vision is really narrow. I can see only this much at a time, but whatever I see, I love it. And it's what you see is amazing, especially when you do endos. It helps you when you do really nice margins for crowns and veneers. It helps you when you do surgical procedures. It could be difficult when you do extraction, but overall, it helps you significantly. The goal is always to slow down to speed up. If you're able to do right way when it's given, you automatically will increase your speed. Second thing, okay. So now, second thing I use I won't practice dentistry, it's my camera. So I have Canon Rebel T6i, it's a DSLR camera, and I use macro lens. Currently, I'm using Make twin flashes. I used to use ring flashes, and occasionally for portrait, I use newer speed light. And I know this information looks overwhelming, okay, and looks expensive, but to give you a little bit of rundown, in 2017, I just bought a camera. Black Friday, this camera was on sale. I bought this camera. I did not think about macro lens. I did not have any flash. I just bought the camera. In 2018, I bought macro lens, and this is whatever the price is, it's there. It's a refurbished price. Only brand new things I bought is twin flash and a ring flash, and these are the still reasonable price. And if anybody wants more lens, any photographic equipment, I buy from B&H. It's a really good website, and they have a lot of refurbished too, and still using these products till today. In 2019, I bought ring flash. 2020, I bought twin flash. Every year, I'm adding something. And last year, again during Black Friday on Amazon, there was like studio setup from Nivar was on sale, and it was like 30% of the price. So, like that's it doesn't need to be branded. It doesn't need to be expensive. Only thing it matters, it works. And so far I've showed you some of the picture. You cannot tell a difference. It's from a cheaper or expensive camera. All it matters, light. All it matters, light. You should be able to play with the light. You should be able to tweak the light how you want, how your pictures look. And it's a bit of a learning curve, and it takes time. But just make sure every day, take one picture on a patient. Pick one patient and just take pictures. You won't believe if I look back on the first picture, everything. I still have that. I'm like, oh my god, how bad I was. How horrible. I did not have correct lighting. I did not have correct lens. I did not have a flash. I just took a picture and before and after. And it's like the tooth what I'm working, it's not even focused. Some tooth way back in the mouth is focused. And And you look at like in social media, Instagram people, so befores and after, they look beautiful. Believe me, we all started at some spot where we didn't know what we're doing. But if you look at for $1,000, you can have a really great setup to take pictures. And why I'm talking about pictures, because and nowadays, like, you document everything for medical legal purpose. Like, you say, patients say, oh, this wasn't there. You take a picture. I have a documentation. You can document how the disease progressed. Okay, last time you were here, there was a minor wear and tear on this tooth. Now you're going 6 months after, this is what you have. And you just tell them, okay, you see these two pictures, tell me what you see. Before you say, patient will say, oh yeah, there's more wear on this area. And you didn't have to tell them, they know, they can see. And you blow it up on a big screen in front of them, you'll be amazed how many patients will point out before even you say a word. Again, magnification. Like, you can magnify it so much that 0.5 millimeter bevel might look like a freeway to you. And it helps you so much to know to where to work on, what you're lacking. And that's one another point, like self-evaluation. Like when you take these pictures, last 4 years, 5 years, you can see how much you have learned and which area you have to work on. Again, if you want to publish your cases or publish studies, it always the photography helps you to do that. Patient education, and the most in nowadays, marketing. Every doctor, every dental office, they're on Facebook, they're on Instagram, they're on TikTok, and before and after pictures helps. That's how I connected with Fresh Dental Shadowing, like to Instagram, and so it helps you a lot. And I think you must have a camera and loops. And so moving forward, so I'll talk about treatment planning. So this is one of the case, and it's one of the COIS philosophy. And if you look at DST, Digital Smile Design Protocol, and it's always like facially driven treatment planning. You look at patient face before treatment plan anything. Teeth are the part of the face. It represents whole human being. You cannot just focus on one tooth and treatment plan around it. And that's why, again, I took a picture of this patient, retracted. I can see her occlusion level is not aligned with her eye level. Then midline is off. And you send this picture to lab. It has so much information that your lab technician will be helpful. He'll be thanking you. I have this information. I know where to start. Usually they just get models, top and the bottom models, and like, where should I start? They won't tell you, but they know. They're just gonna by default what they've been doing. But every tooth is different, every patient different. So all the treatment you do, it's customized to the patient need, and that's why you need pictures to communicate. So what he did over here, I sent the pictures. Lab made a wax up the proposed smile based on patient proportion, and I transfer the smile from the model to patient's teeth. And I know we don't. The before picture was the patient had a lot of spacing and the teeth want to restore that only front 60, even though proposed that okay, it's gonna be off the proportion on the back side, but patient was just focused on front. And after you put wax up, you can see her smile line is kind of parallel to the eye level, and a lot of things are corrected. Her lips are supported much better. And you can see in patient's smile that she had that kind of confidence, and you can see it when all the treatment is done. And this step is also help you to communicate with patient that, okay, this is what I come up with. This is what my lab technician come up with. If you have any feedback, let me know. Sometimes if patient's iffy about it, we let that smile. This is just, I did not touch, I did not even prep, I did not even numb the patient. It's like on a trial smile. So patient can go home, talk to your friends, family, how you feel when you talk, how you feel when you chew, what your friends tell about you. Do you feel that this is too thick, too thin? You can round this off, and that information helps you a lot to jump to final restoration. And over here, everything isn't made up of temporaries, everything is in wax, anything can be done. And it's kind of like a trial smile. Okay, go for test drive and let me know your feedback. And communication helps a lot. Some patient like, okay, why you need to take pictures? You show them before cases if you have done that. And it's always a kind of an obstacle you have to jump through. The first patient will take pictures with, one correct picture might take you 20 minutes. It's okay. And over the time, you will get better. So this is the final picture. You can see like patient smile has significantly improved, and I feel I can see that like she's trying not to hide a smile. She's trying to show more teeth because she believes in it, and when the patient came back, so usually deliver those restorations, let them come back after a week, and you will notice that when patient come back after a week, patient will be kind of dressed up. You'll see like patient like got a hair done or like earrings or makeup, like because they want to fit that smile is going with them. And are you guys able to hear me properly? I know my daughter is crying in the back.
Yeah, we can hear you.
Okay, all right. I'm sorry for that.
It's all good.
So another thing, lasers, and I use a laser on an everyday basis, like in some soft tissue or sometimes doing the crown lengthening, or if doing a little bit gingival tissue. So over here I have two cases over here, and the first one is like arthro for this patient. Patient have a gum growth between the midline. Patient doesn't like it, and it's just like a 5-minute thing. And in the patient head, oh, I'm gonna get a surgery. It's a really invasive procedure. He's gonna use blade. It's gonna bleed a lot. I'm gonna pain. I'm gonna pain medication after that, and just like you numb that. 5 minutes, use a laser, and remove it. And this is like just a before and after, immediate. In the first picture what I was showing between number 8 and 9, it's before and after. I took immediate picture, and follow up after 1 week. You won't even realize like anything ever happened in that area. The second picture, I know it's not cropped properly because this one I just finished on Saturday. So this patient was here for, again, referred by ortho, high frenum attachment. I use a combination of laser and the blade. We put sutures in, remove the tissue. Again, local anesthesia, not that invasive. And this picture is towards the right side where tissue is healing. It's just 2 days post-op. And you can imagine a face have so much of blood supply, tissue heals much, much faster if hygiene, if the cleanliness has been maintained. So even patient was amazed. Okay, well, like I thought, like you're gonna put a sun bandage. I cannot talk for 2 to 3 days. It's just like you just don't have to show patient like pull up your lip again and again. Okay, this is what I got. Just don't do that. That's the only thing. Other than that, keep it clean. Have lots of ice cream, cold food. It's gonna help you a lot to heal faster. And I'm pretty sure after a week, patient will come back. I know I did over there. I know I can see what's going on, but to a layman, it's really difficult to distinguish. Okay, is there anything has been done in that area? And so go to the next one. Let me see. All right. So this is a really interesting case, and I'll be happy if someone wants to respond. And so this patient presented with a fractured tooth on the upper left side. You can see there's a bulk of composite of filling material, and patient had this filling done. It chopped up, came off 3 times. Patient wants some permanent solution. Can you guess, if you guys know, what tooth number it is? If you can. And if you can put in chat box, it's up to you.
I'm not sure. Is it like just tooth is missing?
Yes. So the central incisor is missing. The patient had a composite on. That tooth number 9 is missing. And patient had composite on. That's tooth number 10. And if you can go behind that tooth, there's a canine. So patient is missing central incisor. So I gave a couple of options to the patient. There's that she had spacing in the back. She have a narrow arch. We can move the teeth back, place an implant to add number 9. Second option, we can make number 10 look like 9. Number 11 is 10. And number 12 is 11, so that you have a kind of much more smoother transition. Third option is we can make number 10 look like 9. And I understand some of the patient just want to have a shortest route, and there's nothing wrong with that. So she decided to go just make number 10 look like number 9. And it works out. Like even a lot of people cannot distinguish, okay, there's a tooth missing. They don't know that because all the teeth are there. I know for laymen it's really difficult to understand, okay, what's the difference between canine and lateral incisor. But the smile works out for her and she's really happy with the results. So this case is about minimal invasive because this patient, again, referred by ortho, if you look at the top, on the left side picture, the top one, finish ortho, he had 2 peg laterals. Peg lateral means it's a lateral incisor, it's kind of like a peg shape. So I finished ortho left a perfect space if an ideal lateral incisor, how it will fit in. And at that time, tooth is positioned in such a way I don't have to prep. Tooth was positioned in such a way that I did not do anything. I just packed cord, sent impression to the lab. I did not do anything. And the lab made veneers for me for 2 teeth. And you can see in the bottom of the picture, I just clean up the area, bond the veneer, and no prep. I mean, literally no prep. I'm not saying minimal prep, no prep was done on this patient. And when you tell patients like that, explain like that, and you do it like that, it's a free marketing. It's a free marketing. Patient's gonna get. He did not even use handpiece. I did use handpiece to polish, clean up, but I did not drill the tooth. I did not shape the tooth. It just bonded right on top of that. And again, photographs, communication with the lab, it helps significantly because if you look at his teeth, are kind of the centrals are whitish. Then you go back, it's get a little yellowish. So you have to pick a shade between these two, and that's when pictures helps a lot to pick a shade. And if you go next one, like you have a close-up picture, and you can see. And one big reason why I switched from ring flash to twin, like all my twin flash pictures were a little bit yellowish hue. If we go back, this one, this is a twin flash, because twin flash is coming from both sides, and you can tweak the angle of the light, and it helps. It will give you different results. And for ring, it just comes for the front, so light reflects right, and it have a yellowish tinge. That's why sometimes it can be really difficult to pick a correct shade, and that is one of the reasons why I switched from ring flash to twin flash. But given that ring flash is much more easier to get accustomed to compared to twin flash, because you have to find that sweet spot. Sometimes if you're taking intraoral pictures, like taking number 19 or way in the back, it could be really difficult to control the light, and light comes from different angles, not bouncing the right spot, so it could be a lot of darkness in the mouth. And mouth is a really dark place, that's why you need additional light source. That's why we use flash. When you take portrait, you don't need that. You have a office light and light bouncing off the walls. If you have wall paint is like much more shinier glass finish, then light is bouncing a lot. If you have a matte finish walls, light won't be bouncing a lot. And those things does play a role when you take a portrait pictures. Like, so again, twin flash, I feel like I get much better control than ring flash. And another picture. So this is a really, I don't know if it helps anyone understand. So this picture I taken because I was delivering a crown on patient, I think right side. And most in school they teach us when you deliver a crown, put a cotton roll over the crown and ask patient to bite down. And you won't understand jaw flex, so that, and when you bite the crown, it put a lot of pressure on the crown you're delivering, and other jaw trying hard to come. So if you put a cotton roll on both sides, it creates uniform balance between your crown on your jaw and deliver the crown much easier. You'll be amazed, like sometime you'll see you deliver the crown with a cotton roll, you might have to adjust it, but if you do it both sides, even patient feel better, like, okay, yeah, it makes sense, like I feel good after delivering the crown. So that's it, just one of the tricks I want to share with you. And so yeah, these are like key takeaway from the presentation I have, like invest in camera and good loops, learn as much you can. Dentistry is evolving. Like since I graduate, I have done tons, and it always be beneficial for you. If you want to be a better clinician, you have to learn. And like as you can see, like for any procedure, if you look at, we all started if you're dental school or if you're going to be in dental school, we all start with classroom cavity, and then from now on, you decide how you want to focus on. You want to be cosmetic dentistry, you want to be implant, you want to be oral surgeon, you want ortho. It's so much information coming in. Subscribe to journals to get information, and more you learn, more you know, understand how not to do things. Even if you know some place you go, what they're doing is wrong and it doesn't work out, you still learn what not to do. It's not a bad place to be. Sometimes you learn from some other people's mistake. It's not that person didn't do it right. You know what not to do, and that's the reason we call where do you practice. In healthcare, we do not say where do you work, where do you practice, because every day we practice certain skill to be better, and practice might make you better, but consistent practice will make you exceptional. Along with that, technology. Nowadays, I do most of my, I use DSD protocol. I take pictures, do virtual smile design to convey to patient, this is what can be done, this is what they can envision, and that helps me a lot to convince patient to see. And sometimes it helps me to achieve a certain goal. Okay, this is what need to be done. And even sometimes patient is like, okay, wow, like virtually everything is done before we do anything, before we even take an impression. And nowadays, most of the office use scanners. We don't have to use those GUI impression. Some patients you have to do it. Some patients are not good candidates for scanning. So yeah, use technology like social media. I'm not ashamed to tell you that I have learned so much from Instagram. You connect with so many people, so many clinicians out there, and so far I have found 2 or 3 people who did not respond, but overall, everyone respond. You send them pictures of the case. Okay, can you give me 2 minutes? If they're busy, they say, I cannot do it. If they're not, they'll. And I still, if someone posts a good picture, if you have a question, I'll ask them. And I'm not shy. Okay, fine, I graduated 5 years ago. I'm not. I'm always learning. And you're going to be learning till you retire. And the day when you think you know everything, that's the day you should stop practicing. Because that's when you're going to be harmful to your patient. So it's every day you're going to learn something. Assistant, you're gonna learn something from manager, you're gonna learn something from patient. It is so many things. It just you have to be lifelong learner. You have to think long term, but take short steps. I want to learn, for example, I want to learn photography, and I haven't used studio flash. It's still in my closet. My office doesn't have that space to use it, but I bought it, and I visited practice when I was practicing in North Carolina. Oh yeah, that's another point I want to bring it up. Like, I work on Saturdays, but I always like to have a weekday off. Reason: Saturdays are busy. Yeah, weekday off, you can run errands, or you can visit any local dentist practice. I know nowadays because of COVID, things might be a little bit tricky. They don't want to have another body in the office, but you tell them, I want to shadow, I want to see what you do. If someone specializes in something, and that's the easiest way to learn. If someone's good at implants, ask them, I want to learn implants. Can I shadow you? Yeah. There's really less likely somebody said, no, I don't want to teach you. I don't want to see. People who are really open-minded, really humble, they want to share. And they're, okay, come, join me. And you see like how he does it. And it doesn't matter how he does, it's the perfect way. It's one way of doing it, and it might work in his hand, might not work in someone's hand. And you know, okay, this is the one way to do it. And so, going back to study one practice I visit North Carolina, she have, and they're an amazing couple. They're running this practice for like last 25, 30 years. She showed me every part of the practice, how she runs. They hired a professional photographer to do before and after. She does a lot of orthos, husband a lot of surgeries to take all these pictures. So I asked her, I have a camera, really cheap one. I don't mind if you tell me, okay, it doesn't have that feature, but can you show me? And I had my camera. I just took it with me. And she showed me. And she usually if someone asks me, not in the practice, I usually charge them to teach. And she just yeah, this is what it is. This is the settings. If it doesn't work, send me some pictures after you take the settings. I'll tell you what to tweak and what not to tweak. And that's how, I was telling you, again, I want to learn it. I still ask people. If I see certain artistic shots on Instagram, I bother people a lot. Okay, can you tell me how did you take it? What flash did you use? What setting did you use? And I'm not ashamed of doing that. I'll just keep asking people. So that's why I take short step. It doesn't matter that where you want to reach. You just have to start walking toward the destination. And if you don't walk toward the destination, you're not gonna reach ever. And before you make any decision, gather as much information as you can before I do anything. And just an example, before coming to the United States, and it's I'm the only guy from my whole family in this country, and it was really overwhelming when I came. But gathering information helps you so much to be able to achieve what you want. And asking people advice, nothing wrong with that, but do what you feel like, do what resonates with you. Another thing, interpersonal skills. You might be an amazing clinician. You know how to do root canals, you know how to do implants, every procedure you can think of dentistry, you know it. But you do not know how to talk to patients. You can explain to another dentist, okay, this is what we do, but break it down so the 5-year-old can understand. Break it down, a layman can understand. That's the analogies. I use a lot of car analogies so that people can relate, and that helps to work in a corporate setting where they have a mixture of different insurance patients, and really different huge group of people comes in, and that helps you practice that skill set. And again, that's why I say dentistry is really easy. Business is hard to, and goal is always not to be busy. Goal is always to be productive. So these are the couple of key takeaways I can provide. And if you guys have any question, I'll be happy to answer.
Well, thank you so much. I know I learned a lot. I'm sure everyone else watching did, how important the cameras are. I never realized that could add a lot to it.
Yeah.
So thank you for sharing.
Welcome.
So we do have a few questions here. Someone asked, would you recommend dentistry with the debt involved?
Dentistry with the debt involved?
Yes.
Question is, we buy a house, we buy a car, and I can guarantee you your DDS will last longer than your car. People still buy Lamborghini, people still buy Ferrari. And it's an investment in you. You can pay it off, and after a while, I feel like it's an investment. You have to change the terminology. It's a debt. I understand debt is a debt, but you have to change the terminology. Does it mean I'm not worried? I am worried about my debt, but what do you get out of it? You get this amazing profession. If you love dentistry, it doesn't matter. You go to work, come back, you enjoy, you make someone smile, someone give you a hug. It's okay. That hug is worth of 500K. I understand. Philosophy-wise, it might be fine, but overall, and I have colleagues they graduated 2 years ago, and they were like, how are we going to manage? I understand dentistry is expensive now, but it's not dying profession. You can still make a lot of money out of it. You have to take a skill set. You have to work on your skills, clinical skills. If you open your own business, I think it's, in a short answer, yes, I would recommend it. Yes.
That's a good way of putting it.
I can keep going on and on. I can prove so many points, but it's worth doing it.
Yeah, that's definitely a good point of seeing it's an investment like any other thing. But so you also mentioned at the beginning that root canals are your favorite procedure.
Yes.
why is that? Because I know a lot of times some people don't like that one as much. It might be their least favorite. So why is that one your favorite?
So when I was in dental school, so I graduated in May 2017. On December 2016, I had a job lined up, and actually everything figured out. I know after that this is where I'm going to go. And I visited practice in December, and one of my friend, a guy who graduated before, he told me like, okay, if you want to be productive, be good at root canal. And I would say I was okay at it, but he said like, to be good at it, you have to practice. So for that one semester from December till I graduate, I go to oral surgery department, get as many molar extracted I can get, open them up, find the canals, once I find it, throw it out. I think overall I did 100 to 150 root canals, extracted teeth, and that sets you apart from the dentist. The patient comes in like, not trying to say like in a bad way, but recent grad don't have a lot of experience in school. Like most of the school, in our USC, like we our requirement was to do one molar root canal, and you don't get anything. Like you don't get enough exposure. It doesn't make you confident. It doesn't make you competent to do that. So that's why it gives me upper hand if I apply for a job for a certain place. Okay, I can do molar root canals. Okay,
Yeah.
fine. Yeah, and also like you do root canals, you're gonna do build up, you're gonna do crown. That patient is not going anywhere. And imagine like if a patient comes, if suppose you go there and you have again, I use car analogy. It's like, okay, fine, you want to get a tire replaced, and you go there and like, yeah, we just replace tires, we don't do alignment, go somewhere else for alignment. Like, why do you replace tires then? And you're like, oh, I'm a dentist, but I don't do root canals. Okay, I know there's here and there you can get a complex case. You have to have to a specialist that is beyond, and it's really humbling that you understand your limit, and patient will appreciate that. They'll tell them, okay, this is beyond my skill set. I'm not going to waste your time and your money and my time to try something on you. I'd rather refer to someone special who specializes in that area, and patient will appreciate that. And here and there, a tooth will humble you. Will tell you you cannot do everything you want. Like sometimes some case will like make you pull your hair. So, and I enjoy because I have good loops. I can see a lot of good things and sit down. I don't have to like. It's really calming to. I don't know why. I just enjoy like from the beginning. I enjoy. And another thing I think I should have added to my takeaways on a long-term goals like short steps. So the first practice I worked. So the insurance covered root canal, but you have to medicate. You have to submit a lot of paperwork. You have to submit full mouth X-rays. You have to submit PA for the panel, full mouth X-ray, and a paperwork to get a one root canal approved. And the root canal one, it wasn't like good reimbursement. But if you really want to learn, the office did not have good endo system, and I had a good endo motor from school, but I bought my own files on good aperture, everything own, so that I can be much more faster. And some of my friends like, okay, it's not a good approach, but today I don't regret that. And I have my own extraction instruments that make me work faster. You will realize once you graduate, time is money.
Yeah.
If you're able to do an extraction in 15 minutes, that pays you $500. And if you're able to do extraction in 5 minutes, again, it's paying $500. You would choose that 5-minute one. And I'm not saying it just because of money. You can do a lot of dentistry in a one day. You can do a lot of, you become fast and efficient. And that's what patient want. And to be honest, you'll hardly find a person, oh, I love dentists. They hate dentists. And if you're able to get them out of pain in 5 minutes, they'll love you.
Yeah, for
so,
sure.
And so that's why, again, like, that's, again, I ramble on, but yeah. I enjoy root canals. It's just fun. It's just fun. More curvy the canal, more happier I'll get. Yeah.
Well, it's good to enjoy it because it's fun.
Yes, it's fun. Yeah.
Because I know sometimes it could take a while, so I'm glad it's.
Yeah, it does take a while, but it's just like your fundamentals, basics should be clear before you approach any shoot. Like case selection is the key. Sometimes you should not like, okay, I can do root canal doesn't mean that every single tooth I can treat. There'll be some patient I cannot, and then those patients are for it.
Perfect. Someone also just asked if someone disqualifies in the Integrated National Dental Board examination, what would you suggest to do until retaking the exam?
Disqualifies, like did not pass? That's what I mean?
I think so.
So they don't tell like in which section do you fail, right? I don't think so.
I could ask. Someone just typed it in the chat if they. I guess if they're saying if they like maybe feel like they didn't do well enough, like and they have to retake it or something, like what to do in that time before retaking it.
Just look at the process, how you approach it, what resources you have done, and again, use social media, Facebook, Student Doctor Network, Instagram. Reach out to people how they have cracked the exams, and I know that couple of resources in YouTube. There are a lot of education videos that teach lectures, and one app called Mental Dental and Dental Decks. These are the good resources to crack the exams and see what you have used and what you did not use, and what you have used, did you use it for full potential, and see if you know where you lack, then half the problem is solved. But if you do not know where you mess it up, then yeah, you might have to do some digging to figure it out. And I feel like when I took my boards, it was part 1 and part 2. It helped me because I had a partner. We both want to go to dental school, and we discussed a lot. If you look at certain thing, you have one perspective, but the other person looking at it, you get two perspectives, and it's always two brains working on the same problem is better than one brain working on one problem. So that's the thing, and it's always helpful to discuss. You remember things, not for the exam, for long term, and the discussion groups. It's always helpful. There's a lot of I think even I'm a part of 2 or 3 WhatsApp groups since 2015 that I still sometimes get messages here and there about the application process for the international medicine. I haven't seen anything across INBD, but if I'll come to know, they can reach out to me on any of the contacts. I'll be happy to help them out. Yeah,
for sure. So that's good to have.
Yeah.
Because they're saying like a study buddy or something.
Yeah, study buddy. Yeah.
Nice. So, you said one of your programs was really condensed. How did you manage your time and stress in that? With it being condensed.
So, it was really stressful, to be honest. And I just want to get out of the school. I was really kind of focusing. So, I was at USC, and USC is it's in Los Angeles. It's really famous for frat parties on the weekends and everything. I did not go to any of them. I did something that I shouldn't have done. I was working Friday night and Saturday night for 2 years, and that one thing I would recommend not to work during dental school because I was scared about student debt. What I've realized, most of the schools, and I think this information most people don't know, most of the dental schools, they provide CEs, continuing education courses on weekends for people across. Other dentists will come and visit. And I took a one endo course at USC for a dentist. Once you graduate, one tip I want to tell you a student, exploit ADA, any organization, any CE course you want to just exploit, because you get student discount. The moment you get DDS behind the name, the prices triples or quadruples. So USC have this A to Z molar endo course. For a general dentist, the price is $4,000. For a student from USC, it was $40. So I talked to the endo faculty. I want to attend it. They're like, we won't provide you instrument. I just want to watch the lecture. Okay, fine. You want to sit in back of the class? I'm okay with that. And that I did towards the end of the program. And that's what I'm saying, like, I work Friday night and Saturday night. I work 7 to 1 a.m. on Friday night and 7 to 3 a.m. on Saturday night. So, would not recommend to work. Most of the schools have CE course. Attend them. While you're a student, exploit. And this will help you to be a better clinician. And to answer the question, I was really focused, like, the school is a full-time job, 8 to 5. And I did not hang out with a lot of people. I'll go with my headphones. So I still have those headphones and put them on, do the work. At 5 o'clock, I close my bench and everything, and I'll leave. At the time 8 to 5, I'll try to finish as much as I can. I can count on my fingers. I hardly went on weekends. It doesn't mean that I was really great at clinical work, but when I was there, I did as much as I can. And for some people it might work, some people it might not work. But look, if I'm going there to work, I'm not going there for chit chat. Like, sometimes my headphones are not even on, and I'm just like, someone coming around, just like, and I just keep working. So stressful, yes. Management, I was just kind of focused in that area.
Yeah, and that's smart to treat it like a full-time job.
And also another way to look at. So I forgot the number. So our tuition was above 200K for 2 years. Okay, and so I divided 200K by amount of days I'm going to be in dental school. So every day is costing me this much money. So, and I was like, okay, at this day, at one particular day, I would need to make sure that I get that much money out of it. Because if I'm just wasting that day, I wasted that money. And I'm not saying this is a really great advice. It will make you more stressful. But for me, I like numbers because numbers don't lie. 1 is 1. In any other country, you go 1 is 1. You cannot change it. In which language you go 1 is 1. So I feel like numbers are much more objective than any other thing. And that's another way I was looking at too. Yeah.
That could also make you more motivated.
Yeah, like, I know some people can be motivated, some people can be depressed. Oh my god, like it can be, it work in both ways. Yeah.
Yeah. So before you did mention your favorite procedure, but I don't think you mentioned your least favorite. So what is your least favorite?
Least favorite is filling. I think I should have a slide on that.
Did
like
you?
I should be.
Maybe I missed it.
I think here it is. Yes. So my least favorites are fillings, but if it is challenging interior restoration, I love it. And again, like I'm sorry, I'm going back again. But this picture I have, like, this patient come in for fracture restoration, and again, I took a picture. The first picture on the on the right hand side, the top picture is a actual situation. The second one, and it's not that clear. The second picture, I put 2 blobs of composite to match the shade. What works, what can blend in. And the third is the final restoration. So my least favorite is fillings, but if it is a challenging, I would love to. If it is a challenging, I would love fillings, anterior restorations. Yeah.
They like the challenging procedures.
Yes.
Sounds like.
Yeah, it's fun. Like, it's just like, and when you do this kind of, it's really fulfilling and rewarding.
Mm-hmm.
Yeah.
I'm sure, like, just being a restorative and cosmetic, like, specifically, is pretty rewarding.
Yes. Yeah, it is.
And
that's why and enjoy it. Like, it's when you enjoy it, it doesn't seem like work. Yeah.
Mm-hmm. So as, like, being that specific type of dentist, what is a day in your life kind of thing? Like, do you have any very common things that you do, or?
No, so as I mentioned that, like, I'm a general dentist, I do everything. It doesn't mean that if it's least favorite, I'm not doing it. I'm still doing it. And so a lot of, like, as a dentist, we do extractions, wisdom teeth, third molar disimpactions, socket preservation, and bone grafting. And I don't have a lot of pictures on implant placements and restorations, but I do those crown lengthening. So, like, overall, like, as a general dentistry, like, full-on general dentistry, I do that. But I enjoy taking pictures for mostly cosmetic cases and restorative cases.
Oh, okay.
Yeah.
That's the.
Yeah.
And would you say that's the most exciting part of your job, is like getting to do those transformations and then take those pictures? Or
I think most exciting when I'm able to get perfect shade.
the perfect shade? Oh.
Perfect shade, yes. And I feel like women have an upper hand. Usually, I try not to do that. I look for 1 or 2 seconds. If I don't do it, I let my assistant. And I have 2 assistants. They're female, and I don't know how they are good at it. So if I were to get one day, I get the shade right, and I'm like, oh wow, I get it right. So yeah, and it just helps. Yeah.
That's good to have. Yeah. And then with the sort of day in your life thing, do you have set hours or do they vary very often?
So I work from Tuesday to Saturday.
Okay.
Mondays are off, so that's what we have today. And from Tuesday to Friday, I work from 10 to 7. On Saturday, I work 8 to 3. 8 to 3, yeah.
Okay. So it's nice to have like a little bit of variation and also the Monday off. I bet.
Yes.
Like when everyone else is going back to work, and then you get the Monday. And then you also said that for you, you had a job lined up right away. So I guess in that case, it was easy to find a job right out of school. Is that the case for most people?
It is easy, to be honest, because it is easy before you graduate, because from March till July, every school will graduate. People will graduate, and at the time, everybody's gonna start looking for job.
Oh yeah.
And if you have something before that, you'll have the peace of mind. And during last semester, it's crazy. So you have to finish requirements. You have to give up boards exams. And for regularly, you have to give your part 2s, or I don't know. It's right now it's INBD, so might be, I don't know at what point during the program they have to give. And then you have to go licensing board exams, and then you have to find job. If you have one thing done, it'll be still stressful, but it'll be less stressful. And it depends what kind of job you're looking for. Like being international, most of the corporates, they sponsor a visa, so I had to find someone who sponsors visa. So I was able to find a couple of corporates, and because I signed up in December, I was able to get 7 of my classmates to the same company.
Oh.
So, and if you know which area you're going, just send a resume, visit the dental office, visit the company, and you'll be amazed. They want to hire as bad as you want a job. So it works for both of them, and it's easy because at the time competition is not that much.
Yeah.
Yeah.
Okay, interesting. And then I'm just out of curiosity, what was your favorite part about dental school? With all the stressful times, was there any
favorite time? I'm thinking.
Or just favorite thing about it, I guess, even though it sounds pretty stressful.
So as I told you, I'm a dentist from India, and I started a dental program. Some things might not make sense at the time when I was in India, and some things clicked, and I was like, oh, this makes sense now. And one of the favorite part over here at USC, suppose you have an exam, I don't know what are the grading criteria. So you do your crown prep, and there's a criteria sheet, and you grade your own crown preps.
Oh.
And the faculty will grade your crown preps, and then he will have access to your grading sheet. If you're both grading sheet, then you what he thinks you made a mistake and you also made a mistake, then you get a higher grade.
Oh, interesting.
Because you know what wrong you have done. and that was really good for me. And due to which, I didn't have to show the faculty again and again during my regular classes. I do something, look at the criteria. This is what I messed up. Something I'm doubtful about, I'll go and show them.
That's helpful too.
And that's I don't know if that was my favorite part, but yes, one of the favorite cases I did a CAD cam denture back in USA. It was you scan the arch next. Usually denture takes 5 to 6 appointments, and this with CAD cam scanning and everything with technology, it just took 3 minutes, 3 appointments. That was like game changer.
Oh.
Yeah.
So is that something that's sort of changing in the field, like game new technologies like that?
Yes, it's significantly. Like nowadays, you can track patient motions, how patient is chewing. You can track progression of disease with scanning. A lot of things. Like it's just like sometimes even your mind cannot even reach there, but technology is out there. Yeah.
Super helpful.
Yeah, super helpful. Yeah.
So I think we have time for one more question here, and my question is like, I know you already gave a lot of tips like in your previous slides, but do you have any other just last tips, like whether that be for dental school or preparing to apply or just anything of that sorts?
To apply for dental school, plan ahead, time management. As you know, like I was prepared with 3 headphones and still did not work. I had to bring the 4th one. So I prepared for 3, but it didn't work. You'll never know where things will backfire. Just prepare for worst. Hope for the best, prepare for the worst, especially for dental school application. Backup. If you have your statement of purpose, all the documents, do not store in one laptop. Transfer in another flash drive or somewhere so that things crashes. You just don't lose your brain. You just have somewhere there. And look at schools, which schools you want to apply. I did not apply. I applied to one tip, yes. Be prepared for rejection. I applied to 28 schools and only 4 of them responded positive. And I got interviews from 3 schools, Virginia, Indiana, and USC. When USC gave acceptance to me, at the same time, I think the same week, Colorado gave me interview call. And I just took USC and okay, fine, I want to be done with it. So don't take it to your heart that you're a bad candidate. Just ask them what you're lacking, what you can work on. Some people might not respond, some people might will. If they will, it will help you.
Okay.
And like, don't think it's the end of the world when you get 24 rejection out of 28.
Yeah.
You all needed just 1 seat in a STEM school. Just 1.
Yeah, you just need 1 acceptance.
Yeah, that's it.
Okay, that's great. Well, thank you so much again for joining us this afternoon. And thank you everyone for watching and spending your time on this Monday afternoon. I hope everyone has a great day. Rest of their day, I should say.
All right. Thank you so much, Hillary and Iris. And say thanks to Myra as well.
Yeah, thank you so much. It was really nice meeting you.
Nice meeting you. Thank you.
Okay.
Have a good. Goodbye.
You too.